Johnson has moved the UK to a higher stage of defence against the virus. He said that if you have a new and continuous cough or have a high temperature, you should self-isolate for 7 days. The aim is to delay an explosion in the number of infections so that hospitals are not overwhelmed. Here's our health and social care correspondent, Victoria MacDonald.
A crowded Trafalgar Square in the very heart of London, and our own image of how it might look if this were a city to go into lockdown. Just a few weeks ago, this seemed unimaginable. Today, the government confirmed we are now moving to a new phase in the fight against COVID-19.
I've got to be clear, we've all got to be clear, this is the worst public health crisis for a generation. Some people compare it to seasonal flu. Alas, that is not right. Owing to the lack of immunity, this disease is more dangerous and it's going to spread further. And I must level with you, level with the British public. More families, many more families are going to lose loved ones before their time.
This isn't lockdown yet, but the contain phase, which relied on hand washing, testing and contact tracing, hasn't worked. Today saw the largest day-on-day increase in numbers since the outbreak began. So it is delay to push the peak of cases away from the winter months and into the warmer weather.
There are currently 590 cases that have been identified in the UK, and there are more than 20 patients on intensive care units. If you calculate what that really means in terms of the total number, it's much more likely that we've got somewhere between 5,000 and 10,000 people infected at the moment.
New stay-at-home guidance has now been issued. If you have symptoms of coronavirus infection, COVID-19, however mild, stay at home and do not leave your house for 7 days from when the symptoms started. And those symptoms are a new continuous cough and/or a high temperature.
At some point in the next few weeks, we are likely to go further. And if someone in a household has those symptoms, we will be asking everyone in that household to stay at home.
No doubt with these images in their minds, the government has also warned people over 70 not to go on cruises and for schools not to take trips abroad. Are they going far enough? Certainly not as far as Ireland, where they've closed schools today, along with colleges and childcare facilities, and have advised against mass gatherings. While in Scotland, the First Minister, Nicola Sturgeon, said that large-scale public events of more than 500 people will be cancelled from Monday.
I think it is incumbent on government to do what we can to remove unnecessary burdens on our public services, and that's the rationale for the decision that I am announcing today.
These pictures from China and more recently from Italy have been distressing, showing frontline health staff working to breaking point, beds running out, crowded wards. This is precisely what the government here does not want to happen. But the organisation Every Doctor, which campaigns for better working conditions, has now written to medical unions asking for their help in ensuring NHS staff are protected.
Rightly, the focus has been on the public, but the public won't be cared for without us and our nursing and physiotherapy and paramedic colleagues doing the job that we do every day. And so I guess it's like when you're on a plane and they tell you that you should put your mask on before putting the mask on your child. I think there's an analogy there that's perhaps helpful, in that we need to do whatever we can to make sure that the workforce that will keep everybody safe and well are able to keep on working.
While much is still unknown about COVID-19, it is now clear that young children are as likely to be infected as adults, but it is not known how much they spread the virus, and that makes the question of closing schools more difficult.
If your goal in your social distancing measures is to stop the outbreak in its tracks, probably you should be closing schools, because even if they're responsible for a little bit of transmission, they're certainly, potential drivers. Whereas if you just want to slow down the outbreak and flatten it, I think the question becomes more complicated.
The UK government has no plans yet to close down schools, and the fact is that older people seem to be more at risk from COVID-19. And while the vast majority will experience mild to moderate symptoms, the Prime Minister today called on society to help each other, to do all we can, and above all, wash your hands.
Victoria MacDonald reporting now. Our political correspondent Liz Bates was at that news conference and joins us from Downing Street. Liz.
Yes, the tone here at Downing Street today, as you can imagine, very sombre, very serious. It's clear that the government has stepped up its response to the coronavirus into a different gear today. There were still questions, though, for Boris Johnson about the UK's response when you compare it to the rest of the world, but he was insisting that they are simply acting on the best scientific and medical advice that they have access to. When it comes to wider political repercussions, though, here in Westminster, Brexit trade talks due to be held next week. They've been cancelled. It's also affected the Labour leadership contest. They have cancelled hustings, and also the suggestion that local elections in May could be cancelled as well. So far-reaching repercussions here in Westminster.
Thanks very much, Liz. Now, as we've heard, Scotland's First Minister, Nicola Sturgeon, has gone further than Boris Johnson in saying that public gatherings of more than 500 people should be banned from next week. Our Scotland correspondent, Kieran Jenkins, is in Edinburgh for us now. Kieran.
Kathy, it is notable that Scotland has gone further than the rest of the UK in cancelling events of more than 500 people from Monday. That means the Old Firm football match this weekend will still go ahead at present, but very soon in Scotland potentially we could have life without some conferences, life without concerts or crowds in sporting events. Now, Nicola Sturgeon was asked if there was any tension with Boris Johnson and his government over this decision. She said, well, you'd have to ask him, but they don't seem to disagree on the science. If you're symptomatic, Nicola Sturgeon said, well, you shouldn't really be going to these events anyway. The new advice is that you should stay at home for 7 days. And her rationale is that in cancelling these events, they're freeing up vital public and emergency services that get tied up on these sorts of occasions. So they say this is primarily about the resilience of emergency services in Scotland. They are anticipating large numbers of people becoming infected, requiring hospital care and intensive care. And there are in Scotland at present just a few hundred intensive care beds.
So right now in Scotland, we are working on plans to double intensive care capacity. We have between 200 and 300 intensive care beds right now. We've got more beds in addition to that for high dependency capacity, but we are working on a plan to double intensive care. I want to say very clearly that even with all of the things we are going to do to try to manage the peak of this, the pressure on our health service is going to be considerable, and that's why this wider planning is so important.
And that's really worth repeating. Even if intensive care beds are doubled, which is a mammoth task in itself, there will still be considerable pressure on the NHS. So change afoot in hospitals, in society, because these large-scale events will be cancelled now in Scotland from Monday with no end date. Life is about to get very different for who knows how long.
Kieran, thanks very much. Well, the Irish Prime Minister, Leo Varadkar, has announced that schools, colleges and childcare facilities in Ireland will close from 6 o'clock tonight and will not reopen until March the 29th to help contain the spread of COVID-19. Jane Dodge is in the town of Dundalk, which is near to the border with Northern Ireland. Jane, what's the latest from there?
These school corridors will be silent now for the next 2 weeks. That announcement that schools, colleges and childcare facilities will close came as a surprise, though, to the head teacher here.
Initially, I think the children, there's that usual big cheer, but then the children, we were with 84 children making confirmation. They were very, very disappointed, not to be going ahead with their confirmation on Saturday week. Some children cried. I think teachers were all very anxious, wondering, has something very serious happened that we're closing at such short notice? It was very short notice for us, really. We had to then spend, the couple of hours we left in the day preparing for, work for the children and getting ready to put it up on our website.
And it's not just classrooms that are empty tonight. Some supermarket shelves are too. Panic buying set in across the Republic after today's announcement, and Dundalk was no exception.
It's been hectic. We've run out of toilet roll, tissues, disinfectant, the whole lot, but we will have some more in, please God, Saturday morning. And it's just mental all day. In every shop in the town has been toilet roll, toilet roll, toilet roll.
Do you think people are justified in this panic buying?
I would be afraid. So I would say yes, they are. You know, it is very frightening what's going on.
One person in the Republic has died from coronavirus. 27 new cases were confirmed today, bringing the total to 70. This disease may not have recognise any borders, but precautions to fight it do. This classroom and many others across the Republic of Ireland will be closed tomorrow, but just up the road across the border in Newry, children will be going to school as normal.
Jane, thanks very much. John.
I've been speaking with the former Health Secretary, Jeremy Hunt. He's now the chairman of the Commons Health Select Committee. And I began by asking him, in light of the Prime Minister's comments about families facing the loss of loved ones, what sort of numbers could we be facing?
Well, I think it is a deeply concerning moment. And if you look at the modelling, the Chief Medical Officer believes we would be lucky to have less than 5% of the population getting the virus. That would suggest a mortality rate 4 or 5 times the annual average for winter flu. And if you look at what happens in other countries, this can often be in the most terrible circumstances. So this is very sobering. But I think the encouraging news from today is that we believe that we are 4 weeks behind Italy. And that is, I think, thanks to heroic efforts to contact trace people who've had the virus or may have the virus. And I think we've probably done more than any other European country to do that. The sobering news is that maybe up to 10,000 people have got the virus as we speak in this country. And that suggests that we are in a very serious emergency.
Now, although they are small countries, Denmark and Ireland have both effectively moved to stop all mass gatherings. Schooling, everything has been closed. Shouldn't that be the measure here?
Well, many people will be surprised and concerned that we're not moving sooner. And the reason is because...
Well, are you surprised?
Yes, I am. And the reason is because one thing we do have now is evidence of countries that appear to have been strikingly successful in turning back the tide of the virus. Thailand, for example, the first country outside China to get the virus, only 59 reported cases. Taiwan, right next door, only 49 cases. The places that have succeeded are the ones that moved earliest to social distancing, that the business of trying to keep the most vulnerable people away from places where they could catch the virus. And so I think people will be concerned that we're not moving sooner to more social distancing. For example, banning external visits to care homes, things like that.
You believe actually we should be moving much faster and we should be taking much more drastic measures?
Well, I am concerned because we've got 4 weeks. We're 4 weeks behind Italy. And what we do every single day of those 4 weeks is absolutely critical. I don't want to second guess the advice the scientists are giving, but I would like to see what the modelling is from the behavioural scientists that says that we can go too early with some of these measures, because I think most people's priority is their elderly loved ones who are most vulnerable, perhaps 8-9% mortality rates if they get the virus, and to do everything possible to make sure that they don't get the virus.
But then if I put you back into your old position as Secretary of State for Health, would you be looking at the health service and saying, yes, I wish we could do this, but actually, in order to bring the health service up to a scale in which it can cope at all, we must not take these drastic measures?
Well, the point of taking drastic measures is to slow the onslaught on the NHS. So 5% of the population get the virus and 5% of those people need an intensive care bed. That's over 150,000 people who will need intensive care, and we only have 4,000 beds. So this phrase, flattening the curve, is incredibly important to delay the moment that it hits the NHS, to give the NHS more time.
2 very short questions. Jeremy Hunt, the optimist, where will we be in 4 weeks? Jeremy Hunt, the pessimist, where will we be in 4 weeks?
Well, I'm still optimistic that we can head off what's happening, those horrific scenes that we're seeing in Italy, because I think the NHS is very good at dealing with these emergencies, and I think we have 4 weeks, and we have a lot more knowledge than the Italian authorities had 4 weeks ago.
And the pessimist?
The pessimist says to me that it is going to be very, very challenging to find enough intensive care beds in whether it's the NHS or any other system, and so we really need to use every hour we have over the next few weeks wisely to make those preparations.
And what would your message to the NHS staff that you used to interact with and run?
They are absolutely amazing, and we know we can count on them, and we know we need to do everything possible to spread the pressure that is coming down the track so that it doesn't all come in a very concentrated period, which means that doctors have to play God and decide who gets to live and who gets to die. That's the biggest nightmare for any doctor, and we want to try and avoid that as much as possible.
Jeremy Hunt, thank you very much indeed for joining us.
Thank you.
Joining me now is Saffron Cordery of the NHS providers and Dr Jenny Vaughan from the Doctors Association, who's been caring for acutely ill patients this week. Dr Jenny Vaughan first, just reflecting on what the former Health Secretary was saying there, a bit of a disagreement with the current Health Secretary's advice. Do you think additional lives will be lost because the government is not now restricting social gatherings?
I think that is possible. The government is saying that they are basing everything on science. But of course, there are concerns about this. And I can tell you now, in the hospitals that I've obviously been I work in 3 different hospitals. Everyone is looking at all the meetings they are going to, and those meetings are being cancelled and they are being conducted in different ways. And so it's hard to think what's the logic of cancelling smaller meetings with a smaller number of people, and yet we're not actually looking at banning larger mass gatherings.
Well, Saffron Cordery, let me ask you to respond to that, and just with the additional information, Czech Republic has far fewer cases in the UK, and they're shutting borders. Denmark's at a comparable number of cases. They're shutting schools and public events. What do they know that we don't?
I think it's how we approach this, and what we've got to be really clear about, and I think we heard it this afternoon from the Chief Medical Officer, is that it's really important not to go too early on this, because we've got to make sure that people can sustain this social isolation, they can sustain not moving around. And I think that is absolutely critical, because we know the behavioural science shows us if people go too early, then they're going to kind of break out of the behaviours that we're asking them to adopt.
But is that about flattening the peak of the epidemic? Because the NHS couldn't currently cope with a massive surge.
Absolutely, and we have to flatten the peak of this epidemic. We really need to make sure that it continues over a sustained period rather than goes right up and comes down, because then we are talking about how we manage the number of patients that will be coming in needing more critical care.
And the NHS couldn't do that if it soars right now?
If it soars right now, we would be really challenged. And we heard the Prime Minister saying that this is the biggest public health challenge of a generation, and it's absolutely critical that we do what we can to smooth this curve, to give us more time to manage people over a sustained period.
Dr Jenny Vaughan, how many intensive care beds do you reckon we're short if this does surge now?
Well, one figure I've heard, and this is the concern, is that at the moment in Italy, they're having to ventilate, as many people are turning up in one day that they would have to ventilate in a month. And then many of these are having to be then ventilated for 2 to 3 weeks. So I think the honest answer to that is we simply don't have enough ICU beds. But equally importantly, if not more importantly, we have a massive staffing shortage. We are 50,000 nurses down. And we have to, if you've got a ventilator, you also have to staff it with critical care nurses. And these are not easy to find, and so many of them are left. The other things that are coming from the front line are people who have still not got reasonable access to personal protective equipment.
Even though you were promised that by the Health Secretary last week.
Absolutely, it's not getting to the front line. And the other thing is, many medical staff, they're turning up for work, they may have a small amount of flu-like symptoms. They're then having to leave the premises, go home. All they want to do is go back and serve their patients. But actually, there's still a delay. It's still taking, in some cases, it's not taking 24 hours. And yet they then can't get back to work. We know that there are medical colleagues of ours undergoing critical care at the moment. All we want to do is get in and serve our patients in a safe way. We really think that there should be priority testing for healthcare workers across this nation, because they are the priority here, looking after the patients so that we can get back and do our jobs on the front line. That's what we're looking to see from the government at the moment.
And if you look at the figures from Italy, horrifying really, when you see the pictures in the hospitals, Italy has, I think, 12.5 critical care beds per 100,000 people. We have 6.6. Are you worried about that lack of beds?
I think what we need to focus on is how we can scale up that critical care capacity, and we know that we can do that. At the moment, we are treating people with coronavirus, and we are also continuing to treat other cases, other emergency situations, and people who have had elective operations, so regular treatments, that kind of thing. We are going to move to a phase, we're not there yet, but we are going to move to a phase where we need to focus on cancelling operations, so we free up critical care beds, so we free up other spaces in hospitals where we can put in that additional capacity. And the other thing we've got to
hang on, let me put that point.
If about the staffing, though, it's all very well having ventilators. I'd like to just come back to this point. We have lost, we are down 50,000 nurses in this country, and most particularly for the ventilators, you need critical care nurses.
The government
where
says
are the staff going to come from?
I mean, the government does say you've got
to supply the ventilators, but where are the staff coming from?
OK, the government says has written a blank cheque to the NHS on coronavirus
But
this
you
week.
can't come up with critical care nurses to staff ventilators just like this. These are the people that we should be welcoming back into this country. Come and staff, come and look after our patients. That is a real worry.
How
you can have
fearful
the
are you
equipment,
about
but you
this?
need the staff on the front line to look after the patients.
How fearful are you about
Very fearful. We will lose our colleagues. We will be burying our colleagues. We know that. We know that's happened in China. We know that's in Italy. But let's not make no mistake about this. The medical front line is ready, willing and able to try and help deal with this pandemic. But we must have faster testing, more equipment, and we must have the proper staffing to try and help us deal with this.
It's really sobering hearing you talk about burying your colleagues.
Yes.
And obviously the Prime Minister today talking about preparing people to lose their loved ones. Are people in any way psychologically ready for the scale of loss that we may be looking at?
I think what we are looking at is an epidemic in this country. We know that people don't have the immunity to this particular virus, which is why it is taking hold. So we do need to be prepared for the seriousness of this. And I think this is also about everyone taking responsibility for what they're doing. The hand washing message is I heard someone talking about it today, a health official saying it's screamingly important that we wash our hands regularly. But we also have to do some other responsible things, like making sure we can discharge fit people from hospital. So making sure that there's a clear path out into social care, not all of those waits while people choose a social care home. Let's get them in there quickly. So it's about clearing capacity. But I don't want to undermine what my colleague has said there. It's absolutely critical that we realise that this is a really challenging situation. Staff on the front line, hospital leaders, ambulance trust leaders, those working in mental health, all pulling together to do what they can. But it's going to be really challenging. But they've got the plans in place and they are doing everything they can.
And staff, what about staff having to make hard decisions? You know, in Italy, anyone over the age of 65 or even young people with pre-existing conditions, many of those are simply not making it anywhere near a ventilator. There are some really concerning issues that, you know, on the front line, we are worried about making those hard decisions and having real guidance so that when professionals are on the front line having to do it, they are able to do it. It's incredibly difficult.